Inclusive leadership and intent to stay. In a Midwestern U.S. nonprofit faith-based hospital, a cross-sectional study of nursing staff. The healthcare industry is facing unprecedented challenges related to nursing shortages and staff retention. In response to escalating turnover rates, particularly after the COVID-19 pandemic, healthcare organizations are seeking evidence-based, culture-based strategies to support long-term workforce stability. This study explored the gap in evidence linking perceived inclusive leadership and nurses' intent to stay at a single Midwestern faith-based medical center. Inclusive leadership, defined by behaviors that promote fairness, value uniqueness, and foster belonging, has emerged as a potential driver of employee engagement and their intent to stay employed. A cross-sectional survey using a validated inclusive leadership questionnaire, ILQ, was administered to a convenience sampling of frontline nurses and nurse managers at a single hospital. Nurses rated leadership behaviors. Managers assessed organizational support for becoming inclusive leaders. A total of 71 responses, 59 nurses and 12 managers, were analyzed. Associations between leadership perceptions, inclusivity and intent to stay were analyzed using one-way analysis of variance of the categorized ILQ scores and nurse self-reported intent to stay. Nurses perceived their managers as inclusive, especially in fostering belonging and support. However, weaker scores in team integration highlight ongoing challenges with collaboration. A disconnect between leadership behaviors and organizational support for inclusive leadership suggests systemic gaps. Inclusive leadership was positively linked to retention, particularly for long-tenured staff, emphasizing its long-term value. Results showed that nurses who perceived higher levels of inclusive leadership were significantly more likely to express an intent to stay, P equals 0.01, particularly among those with longer tenure. Belonging and individual support were the highest-rated dimensions, while integration and fairness across teams were noted as areas needing improvement. Nurse managers reported moderate organizational support for inclusive leadership. The study concludes that inclusive leadership is associated with a meaningful, actionable strategy for improving nurse intent to stay. Embedding inclusive practices in leadership development and aligning systems to support them may help healthcare organizations foster long-term commitment and address persistent workforce challenges. Authors: R Swen, David W. Brown, Mary Luallen.